The gentleman yields. The chair now recognizes Representative DeGette for her 5 minutes of questioning.
Thank you, Mr. Chairman. We can all agree that a strong public health and biodefense system is critical to keep Americans safe. But as Dr. Haver so eloquently stated in her opening statement and then in questioning, because of this administration's dangerous denial of science and also their irresponsible budget cuts to the agencies responsible for biodefense, early detection and addressing it is in even worse shape than it was when we had the pandemic in 2020. And let's just go back to this measles outbreak that we have. 168 South Carolinians are in quarantine, and many of them might spend Christmas that way. Of 135 confirmed cases in the outbreak, 127 of the people are known to be unvaccinated, and one of them, only one, was fully vaccinated against measles. We've had nearly 2,000 measles cases nationwide this year, the most since 1992, meaning we have erased almost 30 years of progress in just 11 months, and we're likely going to lose our measles elimination status. Let that sink in. Dr. Havers, what has led to this?
A number of things have led to this, but I think the most important one is that decades of anti-vaccine misinformation spread by Secretary Kennedy and others have led to declining measles vaccination rates in the population and a loss of herd immunity, meaning that once measles is introduced into a community, it can spread unchecked. Once it is spreading, it is very hard to contain. It's one of the most infectious pathogens that we have. So I think, but in this setting, in this administration, has failed to control these outbreaks. Local public health that's needed for contact tracing and response are inadequately funded. Communications coming out of CDC have been mixed. And we have a health secretary that is, on one hand, saying, yes, I support vaccination during an outbreak, but then is putting false information linking vaccines and autism on an official CDC website. I am not surprised we have not been, this administration, we have not been able to control this.
And let's talk about that. Earlier this year, the administration cut $11.4 billion for the state and local public health people that you're saying are the ones that have to track this. Is that right?
Yes, I mean, huge funding cuts have happened.
And a lot of that was restored to blue states after they sued in court, but others are still out billions of dollars meant for public health. How does that impact our preparedness to take on an emerging biological threat?
Well, I think that weakening state and local public health departments means that we are unable to, we will not have the resources on the ground to respond to a threat. I also think that there's a risk that in this environment where federal funding is cut to areas that have weaker state and local health departments, we'll see greater disparities and greater harm and greater negative impacts of a potential pandemic in, for example, red states that don't have a strong local health department.
Which is crazy. That's crazy. Yeah. Now, Mr. Chairman, as you know, I'm the ranking member of the Health Subcommittee, and on February 19th, March 7th, April 1st, September 3rd, September 4th, September 10th, September 17th, September 18th, and December 12th, I requested hearings on behalf of my subcommittee to no avail on this. The Health Subcommittee, in the midst of this breakout and crisis, has not met since September, and the Health Subcommittee has only met 9 times this Congress between hearings and markups, and I think this is because the majority is afraid of bringing RFK Jr. in, as Mr. Pallone moved that we do. I just want to put in the record a sampling of the devastation of our public health agencies and capabilities that RFK Jr. has presided over, in no particular order. Testifying to Congress that he had no awareness of DOJ's activities that devastated research, either lying about his involvement or allowing an unauthorized entity to run amok in his own department without his knowledge. Firing the new CDC director, Susan Monterez, within weeks of her confirmation, and forcing the resignation of multiple other CDC senior leaders like Dr. Havers, sitting right here today, completely destabilizing our nation's public health agency, removing all members of ACIP, and installing compromised, unqualified loyalists leading to the end of an evidence-based recommendation for universal hepatitis B vaccination, cutting U.S. support for mRNA research, which is what helped us get the COVID vaccine. I could go on, but my time is ending. This is why, Mr. Chairman, early in the new year, first week of January, I demand that we have a hearing in the House subcommittee with RFK Jr. so he can come and talk to us about how he's going to reverse these dangerous policies that he's instituted. I yield back.